multidisciplinary care coordination in fertility care, collaborating with mental health professionals, genetic counselors, and other specialists. Fertility care often requires the expertise and collaboration of a multidisciplinary team to address the various medical, psychological, and emotional needs of patients. Fertility patients face complex, multifaceted issues, ranging from the physical aspects of fertility treatments to the emotional, psychological, and genetic concerns associated with reproductive health. Multidisciplinary care coordination ensures that all aspects of patient care are addressed holistically, improving the patient experience and overall treatment outcomes. 1. The importance of multidisciplinary care coordination. In fertility care, the journey can be long, emotionally challenging, and medically complex. Patients often need a range of services and support to navigate the emotional, medical, and logistical challenges they face. Here are key reasons why multidisciplinary care coordination is crucial. Comprehensive support. Fertility care involves multiple domains, such as medical treatment, emotional health, genetic counseling, and financial support. Collaboration among professionals ensures all needs are met. Holistic approach, treating only the physical aspects of fertility, can overlook important psychological, genetic, and social factors. A multidisciplinary approach helps ensure that the patient's mental and emotional well-being is prioritized alongside medical care. Improved patient outcomes. When mental health professionals, genetic counselors, and fertility specialists work together, it improves patient satisfaction, reduces stress, and increases the likelihood of a positive treatment outcome. Patient-centered care. Coordinated care means that treatment decisions are made with input from all specialists, ensuring that the patient's personal goals and values are central to the care plan. 2. Key members of the multidisciplinary team. A fertility specialist, reproductive endocrinologist. Role. These specialists are the core members of the fertility team. They manage medical aspects, including ovulation induction, in vitro fertilization, IVF, sperm retrieval, and embryo transfer. Collaboration. Fertility specialists work closely with other team members to assess and address any underlying medical or genetic factors affecting fertility. B. Mental health professionals. Role. Mental health professionals, such as psychologists, psychiatrists, or licensed counselors, play a critical role in helping patients cope with the emotional stress and psychological impacts of infertility. Functions. Emotional support, providing coping mechanisms and emotional guidance during treatment cycles. Therapy, offering individual therapy or couples counseling to address feelings of isolation, stress, depression, and anxiety. Stress management, helping patients manage stress through mindfulness, cognitive behavioral therapy, CBT, and relaxation techniques. Collaborative efforts. Fertility specialists should refer patients to mental health professionals, especially when there is significant psychological distress or emotional difficulty related to treatment. Mental health professionals can provide important feedback on how a patient is coping with the fertility journey, helping fertility specialists adjust treatment plans accordingly. C. Genetic counselors. Role. Genetic counselors help patients understand genetic conditions that may affect fertility or pregnancy outcomes, and they provide counseling on genetic testing. Functions: genetic risk assessment, evaluating family histories to identify genetic disorders that may impact fertility or the health of a potential pregnancy, e.g., BRCA gene mutations. Pre-implantation genetic testing, PGT, assisting in decisions regarding PGT for aneuploidy to detect chromosomal abnormalities, or PGT-M for inherited genetic conditions. Carrier screening, helping patients understand whether they are carriers of inherited genetic conditions that could affect their offspring. Collaborative efforts. Genetic counselors collaborate with fertility specialists to decide when and how genetic testing should be incorporated into treatment plans. They also provide emotional support to patients who may face difficult decisions based on genetic test results, such as whether to proceed with certain treatments or select embryos with certain genetic profiles. D. Nurses and physician assistants. Role: nurses and physician assistants play a key role in patient education, support, and coordination of care. Functions: patient education, providing detailed information on fertility treatment procedures, medications, and side effects. Support: offering emotional support during difficult treatment cycles and addressing any concerns or questions patients may have. Follow-up care: monitoring patients during treatment cycles, ensuring they understand and follow medical instructions. Collaborative efforts: nurses and physician assistants coordinate between specialists, ensuring that all medical and psychological support services are aligned with the patient's treatment goals. E. Andrologists and embryologists. Role: andrologists focus on male fertility, particularly sperm analysis and retrieval. Embryologists specialize in the fertilization process, embryo culture, and cryopreservation. Functions: andrologists evaluate sperm quality and quantity, identify male fertility issues, and assist with sperm retrieval. Embryologists monitor embryo development, perform in vitro fertilization, conduct embryo cryopreservation, and assess embryo quality before transfer. Collaborative efforts: andrologists and embryologists collaborate with fertility specialists to ensure the best possible outcome for both the male and female partners in fertility treatment. 3. Benefits of multidisciplinary care coordination. A. Addressing emotional and psychological aspects. Fertility treatments can be physically and emotionally demanding. Mental health professionals work with patients to manage feelings of grief, frustration, or hopelessness that often accompany infertility. Addressing these emotional challenges is essential to support patients through the stress of treatment cycles. B. Comprehensive genetic support. Genetic counseling helps patients understand how genetic conditions may affect their fertility or offspring. This can guide decisions around fertility treatment options, such as the use of donor sperm or egg, pre-implantation genetic testing, PGT, and whether certain genetic risks should be avoided or managed. C. Improved patient satisfaction. When patients know they are receiving holistic care with the expertise of various professionals, their satisfaction with the treatment process increases. A multidisciplinary team approach helps ensure that patients are fully informed, emotionally supported, and physically cared for throughout their fertility journey. D. Coordinated treatment plans. With input from specialists in different fields, fertility treatment plans can be customized to fit each patient's medical, emotional, and genetic needs. For instance, a patient with a genetic condition may need a specific treatment plan that includes PGTM and the involvement of a genetic counselor alongside fertility specialists and mental health professionals. 4. Challenges in multidisciplinary care coordination. A. Communication barriers. Effective communication is key to successful multidisciplinary care, but barriers can arise. These may include differences in professional jargon, treatment philosophies, or treatment protocols among healthcare providers. B. Conflicting recommendations. At times, specialists may offer conflicting recommendations due to differences in their respective areas of expertise. For example, a mental health professional might suggest delaying treatment due to the patient's emotional readiness, while a fertility specialist may recommend proceeding with IVF immediately. C. Integrated systems and data sharing. For effective collaboration, health systems need to have integrated systems for sharing patient data. Privacy concerns, regulatory compliance such as HIPAA, and differing data systems across professionals can make this challenging. 5. Best practices for multidisciplinary care coordination. A. Clear communication channels. Establish regular communication between all specialists involved in the patient's care. Regular case meetings, shared electronic health records, and interdisciplinary rounds ensure that all team members are informed and on the same page. B. Joint decision making. Ensure that patients are involved in the decision-making process with input from all relevant specialists. Provide a collaborative approach where the patient feels empowered to make informed decisions based on all available options. C. Psychological and emotional support integration. Mental health professionals should be embedded in the fertility care process with clear roles in providing psychological support and guidance. This can be done by offering counseling before and after treatments, as well as ongoing emotional support through the treatment cycle. 6. Conclusion. Multidisciplinary care coordination is vital in fertility care to ensure that all aspects of a patient's needs, medical, emotional, psychological, and genetic, are addressed. By collaborating with mental health professionals, genetic counselors, and other specialists, fertility care providers can offer comprehensive, holistic care leading to better treatment outcomes, improved patient satisfaction, and enhanced emotional support for those navigating the complex and often stressful world of fertility treatment.